Hello, so this is about adolescence, substance use, and family involvement. There is a lot of research on the relationship between adolescence and substance use. Though the research tends to focus on what substances do to the brain and what factors put adolescents at risk for substance use disorders. In recent years, the focus of research has been on early intervention as a key strategy for improving short and long-term adolescent health. There are many factors that play a role in adolescent substance use. A national survey results on drug and alcohol use in the USA indicates that alcohol and cannabis use among full-time college students is on a rise. Transitional youth ages 18 to 25 reported highest percentage of alcohol dependence and abuse among all age groups. Adolescent problem and binge drinkers who continue to abuse substances into adulthood are more likely to commit both violent and nonviolent crimes and have a cohabitation and employment problems later in life. Community, peer pressure, family structure, stress, socioeconomic status, neighborhood, mental health, family substance use, and body development all play a role in an adolescent's life. With the rising number of substance use, it is important that we identify the risk factors. So this is Article 1. The title is Neighborhood, Family, and Peer Factors Associated with Early Adolescent Smoking and Alcohol Use. There is a broad agreement that neighborhood context is important for young adult development. The article reviews the few studies on the association between neighborhood socioeconomic context and adolescent smoking and alcohol use. This article takes into account the differences in family and peer factors for substance use. So in this present study, they incorporated family and peer risk factors for substance use established by prevention science frameworks. Data was drawn from the Seattle Social Development Project. This project is a longitude theory-driven study orientation in 18 Seattle elementary schools, overrepresenting high-crime neighborhoods. The Seattle Social Development Project conducted interviews in 1985 with 808 students in the 5th grade, when most participants were 10 years old. The result of this study helped to clarify the role of neighborhood, family, and peer context factors in the early onset of smoking and alcohol use. This study found evidence that living in more disadvantaged socioeconomic disadvantaged neighborhoods was associated with both early adolescent smoking and alcohol use from grades 5 to 9. Higher family income was found to be protective against smoking, but not alcohol use. The result of this study highlights the importance of neighborhood, family, and peer factors in early adolescent smoking and alcohol. So this is Article 2, Youth Perceived Parental Influence on Substance Use Changes and Motivation to Seek Treatment. This article investigates the relationship between parental influence on substance use and the adolescent motivation to change. While the task of dealing with substance use related issues often falls on the family's little research has been done exploring the importance of family as a motivator for seeking treatment. This paper reports on a quantitative study of youth seeking substance use treatment at a large urban psychiatric hospital. The research strategy used was conducting interviews with 31 youth between the ages of 16 to 25 years of age. The interviews were conducted individually and lasted 45 to 90 minutes. The youth were asked 3 questions. From these 3 questions, youth overwhelmingly described their parents as pressuring them to seek substance use treatment. They described the pressure from their parents as pivotal to them having the motivation to seek treatment. Youth also described their parents as providing compassionate and facilitative support to make changes. Support from parents was reported as instrumental and lacking in emotional support. In addition to describing how their parents motivate them to reduce substance use and seek treatment, youth often mentioned that parents lack knowledge to help them change behaviors. This article stressed the importance of parental involvement in youth substance use treatment, and the need for educational information for parents to assist their youth. Article 3, this is the prospective impact of family functioning and parenting practices on court-involved youth substance use and delinquent behavior. Youth who are involved in court systems have high rates of psychiatric symptoms and substance use. While the relationship between court-involved youth and substance use is well known, little is known about the contributing roles of the caregiver and family factors. Most of the court-involved youth are not in prisons and reside in the community with family. For this reason, it is important to understand how family roles contribute to youth substance abuse delinquency. This current study expands on prior research by including a prospective design focused on first-time offending youth, caregiver and youth perspectives, and includes youth psychiatric symptoms, substance use, and delinquency. Participants in this study were 400 first-time offending court-involved youth and an involved caregiver. Youth were 14 years of age on average, predominantly male, and racially and ethnically diverse. Over 60% of families earn less than $30,000 annually. The result of this study demonstrated that family functioning, which is influenced by caregiver and youth psychiatric symptoms, has critical implications for youth substance use. This also demonstrates a need to address the needs of the family in court-involved youth cases. So this is Article 4, Well-being and Substance Use in Emerging Adulthood, the role of individual and family factors in childhood and adolescence. The average age for assuming adult roles, such as parenthood, marriage, and beginning a career, continues to rise in the United States. As they do, Arnett and Arnett argue that the transition from adolescence to adulthood becomes its own developmental stage. This stage is full of opportunities and challenges. For many young adults, the most salient issues that affect health are overall well-being and substance use. Young adults in this stage also struggle with higher rates of depression and anxiety and lower self-esteem. The negative consequence of substance use has been well documented. During this time, prevalence of substance use peaks. While many studies have examined concurrent predictors of emerging adulthood status at a single ping, it is less common to study hypothesized causal influences from childhood to adolescence. To address their research questions, the authors utilized data from the Child Development Supplement and Transition to Adulthood surveys. From this data, several important implications came up. Findings showed that after holding other covariates constant, individual behavioral problems in childhood and adolescence related to subsequent outcome, including negative well-being and a higher likelihood of cigarette smoking. However, individual problems did not relate to substance use. So they found that basically that subsequent outcomes, behavioral problems in childhood related to more to negative well-being and higher likelihood of smoking cigarettes and drinking. But individual problems did not. So anyway. So Article 5. School, peer, and family relationships and adolescent substance use, subjective well-being, and mental health system in Wales. This article is discussing the positive relationship between family, friends, and school staff, and health and well-being during adolescence. The study conducted for this article tests the independent and interacting roles of family, peer, and school relations in predicting substance use, subjective well-being, and mental health systems among 11 to 16-year-olds in Wales. It presents a cross-sectional analysis of the 2013 Health Behavioral in School-Aged Children Survey, completed by 9,055 young people aged 11 to 16 years. Positive relationships with family and school staff were consistently associated with better outcomes. Adolescence in a critical life course period for young people's health and wellness. An estimated 1 in 5 adolescents have a diagnosable mental health problem. Influences from family and friends on young people's substance use have commonly been investigated using the social development model. The SDM hypothesis that social behaviors are learned through social interaction, which give rise to formation of attachment with lasting effect on behavior. Though supporting development of skills, norms, and values, young people with less supportive family environments might therefore engage less with schooling or develop fewer good quality friendships. Consistent with previous literature, this paper demonstrates significant associations between young people's interactions with family, friends, and school, and their health and well-being. So, Article 6, parents, peers, received risk of harm in the neighborhood, contextualizing key factors on adolescent substance use. This study took a little broader view than the previous papers. This study examined the role of neighborhood opportunities for substance use in promoting adolescent substance use. Data was conducted from 2 compounds of the project on human development in Chicago neighborhoods. This study contributes to the literature by investigating the direct and indirect mechanisms through which neighborhood norms conducive to substance use impact adolescent substance use. This study did not detect or mediate effect of neighborhood opportunities for substance use on adolescent substance use. Overall, the lack of support for the first 2 sets of hypotheses is not surprising given inconsistencies in the existing literature pertaining to the effects of the neighborhood characteristics on youth substance use. So, in conclusion, all 6 of these articles show the importance of community and family involvement with adolescents struggling with a substance use problem. These articles also show a lack in education and the best way to support adolescents. So that's it for this. Thank you for listening.